627 new cases since we last updated you. I'm very sad to have to inform all Victorians that the total number of fatalities as a result of this global pandemic is now 112 people. That is 8 more than when we updated you from the podium yesterday. If further information can be provided, of course we will, but at this stage I'm able to confirm 2 men in their 50s, 2 men in their 70s, 3 men in their 80s and 1 woman in her 70s. 4 of those 8 tragedies can be linked back to aged care. Can I again send my best wishes to and my sincere condolences to each of those families. This will be a very, very confronting and challenging time for them, one of great sadness. So we send our best wishes and our support to each and every one of those families. In terms of testing, we have now done 1,608,452 tests. That's 33,826 additional. In terms of hospitals, there are 349 Victorians in hospital. 37 of those are receiving intensive care. In aged care, the total number of active cases linked to aged care is 928. And there are some 1,030 health workers who are active cases as well. I wanted to just take people through a couple of updates, and then of course we're happy to take questions. First things first, you've heard me speak a couple of times now about the tremendous partnership between the ADF and authorised officers from the Department of Health and Human Services and the program of door knocking that they're currently undertaking amongst, in the first instance, those who can't be reached by phone who are positive cases, and that has now moved to a situation where all positive cases are being door knocked. And I think we will get very close. Today will be the first day where we've been able to achieve that. It's steadily building, as I think these numbers indicate. So since the 22nd of July, we are visiting each and every one of those who are positive. As I said, in the first instance, those that couldn't be contacted despite multiple phone calls, and now that's becoming a blanket policy, if you like, to all positive cases. Yesterday, so the 30th of July, was the second day of the big scale-up. ADF and DHHS conducted more than 500 visits. That's almost double the visits that were conducted the previous day at about 269. There are 34 teams of 3. It was 30 teams on the 29th of July and 18 teams on the 28th. So you can see that's scaling up, that's building. Disappointingly, I have to inform you that there were more than 130 unsuccessful visits, so around 1 in 4 people cannot be found at home. There'll be a multitude of reasons for that, but what I can confirm for you is that more than 100 cases have been referred to Victoria Police. It is simply unacceptable for you to have this virus and not be at home. If you're out doing other things, there may be a handful who are out getting some fresh air. That does not explain these numbers. These numbers go well and truly beyond anything like that, and all that will do is spread the virus. So I would appeal to each and every person who's got a positive diagnosis, as well as each and every person who's waiting for a test result, as well as all of those close contacts. We've all got to do the right thing. We've all got to play our part, and particularly for those who are positive, then the only place to be is at home. It is just not, it's not acceptable, and no element of this strategy will be successful if when we door knock you, we're finding 1 in 4 people not at home, they're somewhere else. Those matters have been referred to Victoria Police. That'll be a matter for them to investigate and deal with those issues on their merits. That is obviously a matter for them. Can I thank those ADF staff? Can I thank the DHHS staff that are out with them? Again, whilst it's important and there's no alternative but to focus on those numbers of people who weren't where they should have been, I would also just point out that this is not just about compliance, it's about providing information and clarity, and it's also about us saying to each of those families, because many of them, there may be one positive case but they live in a household, saying to those families, what can we do for you? Is there anything you need? And as I said yesterday, we've been able to have groceries bought and sent to people. We've been able to have scripts filled where people were not able to leave the house to go to a pharmacy. It's a long list of different support. So it's not just about checking, as important as that is, it's also about reaching out and providing support and care, as well as the information and clarity that every single person needs.